Mi chiamo Raffaella Fagioli, sono direttore clinico di una fondazione di genitori. La mia domanda è forse più per la professoressa Olin, di cui seguo i lavori da tanti anni. Rispetto al passaggio dall'adolescenza all'età adulta delle persone con autismo ad alto funzionamento, non tutti sono in grado alla fine della scuola superiore di poter andare all'università. Nella mia esperienza pochi riescono a fare questo passaggio. Io trovo che sia difficile collocarli anche da un punto di vista professionale, anche perché sono persone che maturano psicologicamente, nella mia esperienza, molto più lentamente. E vorrei sapere se questa è anche l'esperienza della professoressa e degli studi che fate voi, cioè se vedete questa maturazione psicologica più lenta, per cui hanno bisogno di più tempo per poter maturare le competenze per entrare nel mondo del lavoro. Grazie.
Thank you for the question, which I think is a very important one. People often, the maturation process is slower because, of course, these individuals have so many other difficulties to deal with. So it's not surprising that they can be slow. They're slow to develop in early childhood. So there's a lot of catching up to do. And I think that the problem with the education system is that formally it stops at 19 when they're supposed to be adult. But for many people, they need education to go on long after those years, to get them to a level where they're really fulfilling their potential, whatever that is. So they may be much later to go into college, and subsequently will have difficulties finding work, so will be later then. With the right sort of help at the right sort of stages, I think people could do a great deal, achieve a great deal more than they actually do. But they're sort of shoehorned. You know, at 19 you have to do this, at 21 you have to do this, and those models don't really fit with the maturation levels and of people, not just with autism, but with other developmental disabilities as well. But it's getting services to understand and be more flexible. We talk about the inflexibility of people with autism, but actually the inflexibility of services is often the bigger problem, I think.
Hello. I totally agree, up here. I totally agree that monitoring mental health can be and is of the most importance when we are talking about old age and in autism and learning disabilities. But from my experience in the UK, I've come across with a lot of difficulty from the mental health assessors when they do need to do a mental health assessment with someone who has learning disabilities and autism, for example. They do tend to find it very difficult to do those assessments. My question was if there are any effective ways of assessing mental health issues in people with learning disabilities.
I think the problem is one needs professionals who are expert in mental health issues, but also experts in developmental disorders, not just autism, I think. And getting the two together is very difficult. As I said this morning, I think that very many of our child psychiatrists, for example, are very well trained in picking up emotional and other problems in children with autism or other developmental disorders. But in the adult psychiatry world, they have much less skill and knowledge about developmental disorders and the trajectory of people with developmental disorders over time. So I think with an expert in both sides of the coin, then mental health problems can be diagnosed. Treatment is obviously more of an issue because our treatments are focused very much on talking therapies, which don't necessarily suit so well adults with autism and mental health problems. There's certainly a great deal of room for improvement. I think it is improving. New generations of psychiatrists coming through have a much more global training, I think, these days than they did. So hopefully the diagnosis of mental health problems will improve, but there's quite a long way to go. And as I say, it's the treatment. Once the problems are diagnosed, it's how we treat that is a major, major challenge.